Now let's create our search strategy. So here's our example that we're going to use for the rest of this presentation. So in agitated children, how do best practices or strategies for de-escalation compared to current practice affect physical injury, medication, and restraint use? First thing you need to do is to pull out a word or a phrase that will represent your concept for each part of your PICA. So our population is going to be agitated children. Our intervention is de-escalation. For the comparison, since we're looking at current practice or best strategies, we're not going to have like a terms that we actually search on. And then lastly, for our outcomes, we're interested in physical injury, medication, and restraint use. So now we've got all of our main concepts, but now we need alternative search terms for each one of those concepts. And some things to keep in mind, if you're doing a search on hypertension, for example, you might also want to use high blood pressure. You got to think about alternative spellings. Depending on what country you might spell pediatric differently. Also, sometimes you might need to broaden or narrow down your search term. So with that, you can like common cold and flu would be narrower versions of respiratory tract infections. So for our agitated children, here is a list of terms we can use to get at that. So you see I've got agitation, anxious, distressed, upset, violent, aggressive, aggression. When you're doing this, you really need to brainstorm all possible options so you can find the articles that touch on those topics. Some good terms for children are going to be child, children, youths, teens, teenagers, adolescents, and then also pediatric. And looking at this, you also want to think about singular and plural. And here's a quick tip and trick. You can truncate search terms with a wildcard character. So the asterisk will help you find the different search for all terms that begin with the word. For example, teen asterisk will find teen, teens, and teenagers. This is just a quick way where you don't have to spell out all of those singular and plural versions of your words. So if I do that wildcard for my prior terms for agitated children, it's now going to look like this. So it just kind of shortens our list. So less things we're going to have to type into our search every time. So now let's brainstorm some other terms that are other concepts. So we've got de-escalation, de-escalate, that's how we're using that asterisk. We can have behavior management. And remember, for that comparison, since we're looking at current or standard practice, we're not going to brainstorm search terms for that one. But then for our outcomes, we can do injury, injuries, wound, wounds, medicate, medication, restraint, immobilization. Now we need to connect all of our search terms to create one focused and productive strategy. And to do that, we're going to use our and, or, and not. And what those do, so when you use and, like if we wanted agitated, and children, and de-escalation, and injury, that's going to find an article that has every single one of those terms in it, which is what we need to answer our question. We don't want an article that just talks about children and injury. We need it to be agitated children with the intervention of de-escalation. Now our or is where we'll go in so we can get all those different search terms that we brainstormed earlier. So we can make sure every article we find is on our topic, no matter what the researcher or author used as their term. So if they used agitated or anxious or violent or aggression, we're still going to find all of those because those still all would cover agitated. And then our last one is going to be the not. So we don't need this for our search example we're doing today, but a good example for this is maybe you're interested in finding articles that talk about cloning, but you've already seen all the stuff that talked about the sheep, so you know Dolly the sheep. So we could do cloning, not sheep, to see what other articles are out there when they use cloning for other animals example. Another one is going to be, as we know, football and soccer, depending on what country you're in, mean different things. So sometimes you might need to use that football, not soccer, to make sure you get articles that are on American football. You can also use not to get rid of different publication types. So like maybe you've run your search and you're seeing a lot of opinion pieces or editorials. So you could run your search again and then do not editorials, not opinions. So you can then find that primary research. So now we've got our OR. We've learned what that does. So this is how we're going to actually write the search so we can actually find all the articles that have our terms in there. So we've got our agitated, or anxious, or distressed, or upset, or violent, or aggression. And then we're going to use that OR same way with all of our children terms. And then this is what it looks like put in that OR for our intervention terms, our de-escalation, our behavior management. And then all of our outcomes, injuries, wounds, restraints. So now we've got our ORs, but again, we got to create one search strategy. We only run one search. So we need to combine all those different concepts into one search. So we've got all of our agitation terms and all of our children terms and all of our intervention terms and all of our outcome terms.